California task force to study and develop reparation proposals for African Americans. Content warning. It contains discussions of racial discrimination, sexual assault, torture, lynching, and other forms of extreme violence. Contains unedited historical quotations and photographs of white supremacist hatred, torture, lynching, autopsy, and other forms of graphic violence.
The Post-Civil Rights Act era. The Civil Rights Act brought marked improvements in addressing healthcare discrimination. 245 However, the United States healthcare system was built upon a foundation of enslavement and segregation, which has never been dismantled. Scholars have stated that the legacy of enslavement and segregation persists in the legal barriers to medical education for African Americans, the anti-Black discrimination in the healthcare profession, and the transformation of hospitals and healthcare into a high-profit industry that has neglected to provide care for African Americans. 246 This legacy of enslavement continues to harm African Americans today, as some scholars have stated, resulting in continued inequities in medical treatment and health outcomes. 247 Medical education. The U.S. Supreme Court's ban on race-based quotas in affirmative action programs for medical schools led to a dearth of Black doctors. 248 In the 1960s, white medical and dental schools began efforts to increase Black enrollment through affirmative action programs to recruit and graduate higher numbers of Black medical students. 249 Affirmative action programs increased the number of Black medical school students from 783, or 2% of all medical students in 1969, to 3,456, or 75% of all medical students by 1975. 250 Of all those who treated Black communities and patient populations, Black physicians provided the most care. 251 The University of California, Davis opened a medical school with an affirmative action program in 1966. 252 However, in 1978, the U.S. Supreme Court ruled that the racial quotas used in this program were unconstitutional in Regents of the University of California versus Back. 253 This ruling reduced the number of Black students admitted in the nation's medical schools, particularly middle and lower-ranked schools, where the percentage of Black students admitted dropped to minuscule levels. 254 There were fewer Black men in U.S. medical schools in 2014 than in 1978. 255 Medical education began to use a colorblind model of selecting and training Black professionals based upon the Back ruling, which has contributed to racial health disparities that exist today. 256 Major growth of the medical sector eventually led the bulk of the nation's hospitals to be operated by the government, large corporations, and not-for-profit healthcare businesses. 257 Due to the transformation of healthcare from a largely government-provided service to a for-profit industry, Black physicians were separated from Black patient populations. 258 Black hospitals were closed and taken over by large corporate entities. 259 Black hospitals were not funded by government, corporate, and nonprofit economic circles and consequently could not afford to remain open. 260 They closed, merged into larger hospital systems, or were renovated into nursing homes by the mid-1980s. 261 The mainstream medical establishment was unorganized and spread out geographically. 262 Black doctors who used to serve Black patients concentrated in Black geographic areas were consequently scattered and unable to continue serving Black patient populations in clinics and hospitals. 263 Research has shown that diversity among physicians leads to better outcomes for Black patients. 264 Non-Black medical students' explicit racist attitudes are associated with decreased intent to practice with underserved or minority populations. 265 One study found that Black patients assigned to a Black doctor increased their demand for preventive care, brought up more medical issues, and were more likely to seek medical advice. 266 Racism by white doctors has led to unconscious bias that has resulted in African Americans receiving inferior medical care as compared to white Americans. 267 Higher implicit bias scores among physicians are associated with biased treatment recommendations for the care of Black patients. 268 Providers' implicit bias affects their nonverbal behavior, which is associated with poor quality of patient-provider communication. 269 Across virtually every type of diagnostic and treatment intervention, African Americans receive fewer procedures and poorer quality medical care than do white Americans. 270 Discrimination in healthcare. Prior to the Civil Rights Act of 1964, federally funded hospitals refused to provide care to black patients. 271 barriers to equality in care for black patients remained even after the passage of the Civil Rights Act 272 due to insufficient government-funded healthcare services, as well as the disempowerment and neglect of black patients by healthcare institutions. Black communities suffered major gaps in healthcare delivery in the impoverished neighborhoods where they lived. 273 black residents who lived in urban poverty received medical care from crowded emergency rooms and outpatient services at overburdened public hospitals, or at small practices of private black physicians. 274. In 1960, there was only one black doctor for every 5,000 black patients, compared to the national average of one doctor for every 670 Americans. 275 poor black women could not afford safe abortions through private doctors and could not receive adequate care at the hospitals and clinics in their communities. 276 hospitals in black neighborhoods were older than public general hospitals. 277 They were usually administered by nonprofit bodies and funded by voluntary contributions and paying patients. 278 They were insufficiently staffed and were in too poor of a physical condition to provide the medical services needed by the black communities around them. 279 As a result, between 1950 to 1970, life expectancy for African Americans remained almost a decade shorter than that of white Americans. 280 Death rates from pneumonia, influenza, and tuberculosis were 2 to 3 times higher for African Americans than white Americans due to lack of access to hospital care. 281 Similarly, maternal mortality rates for black mothers remained 4 times higher than that of white mothers. 282 Black mortality from sexually transmitted infections and tuberculosis remained much higher than that of white Americans. 283 African Americans also continued to suffer from chronic illness at higher rates than white people. 284 In the 1950s and 1960s, the National Association for the Advancement of Colored People brought several lawsuits to force government-funded hospitals to hire black doctors, treat black patients, and desegregate facilities. 285 The federal government filed a brief in support of black patients in Simpkins versus Moses H. Cone Memorial Hospital. However, the government did not always strictly enforce the Civil Rights Act against medical segregation, sometimes leaving black medical professionals to fight case by case in the courts for desegregation. 286 Health Insurance. Insurance status predicts the quality of care a patient will receive. 287 Health insurance is necessary to pay for healthcare procedures, such as preventive care, screenings, disease management, and prescription drugs. 288 In the United States, health insurance is dependent upon employment. 289 In 1942. During World War II, rising prices and competing wages led the federal government to put a cap on wages. 290 Health insurance was an exception to that wage cap, and employer contributions to health insurance premiums were tax-free. 291 Employers began paying for health insurance to lure employees. 292 Eventually, this led employees with higher-paying jobs to receive more benefits from their health coverage than those with lower incomes. 293 Healthcare became a privilege for those with good jobs, rather than a right for all. 294 As discussed in Chapter 10. African Americans have historically not been able to access jobs that provide medical insurance through employers due to barriers to education, employment, and discrimination. 295 Due to employment discrimination, private, job-based health care systems excluded African Americans. 296 Consequently, as of 2018, only 46% of African Americans are covered by employer-sponsored health insurance. 297 As a result, between 1950 to 1970, life expectancy for African Americans remained almost a decade shorter than that of white Americans. In 1960, there was only one black doctor per 5,000 African Americans, compared to one white doctor for every 670 Americans. In the 1960s, President Lyndon B. Johnson's Great Society legislation and the Civil Rights Act and Voting Rights Act contained the seeds for creating a nationwide health care system for all citizens. 298 However, The Medicaid and Medicare programs did not eliminate racial inequality in healthcare. 299 Medicare and Medicaid are health insurance programs paid for by the federal government. 300 Medicare serves people with disabilities and people who are 65 years or older. 301 Medicaid serves people who are low income. 302. Before Medicaid and Medicare, Southern states were resistant to a nationwide health insurance system for all. Due to desegregation brought about by the Civil Rights Legislation 303, they wanted limited federal involvement while continuing to run their own health programs for low-income residents. 304 Before Medicaid's enactment, states had control over federal health insurance programs for low-income residents, which disproportionately included African Americans. 305 These programs were underfunded, and states with large populations of African Americans, Texas, Arkansas, Louisiana, Tennessee, Mississippi, Alabama, Florida, Georgia, South Carolina, and North Carolina, referred to as the Black Belt states, refused to participate in federal health insurance programs. 306 A state-run Medicaid program would limit federal involvement while allowing states to determine eligibility for health insurance programs on their own. 307. The enactment of Medicaid as a program implemented by state governments allowed states to disproportionately exclude Black, low-income populations who otherwise would have qualified for the program. 308 Medicaid provided insurance to low-income and unemployed people. About one-fifth of the Black population was considered poor enough to qualify for Medicaid. 309 Consequently, in the 1970s, 25% of the African American population was uninsured, while only 12% of the general population was uninsured. 310. However, in the 1990s, the Black Belt states changed their income criteria, lowering the threshold income for Medicaid so much that many poor Black families were not considered poor enough to qualify for Medicaid. 311 Reimbursement policies established by government and health insurance regulators limited hospitals and physicians in the type and number of patients they could treat. 312 Consequently, private physicians and hospitals preferred not to treat Medicaid recipients, who lack the funds to access care in a wide range of hospitals. 313 Due to this, throughout the 1990s, about 20% of the nation's Black population lacked health insurance, while 17% of all Americans lacked health insurance. 314. The Affordable Care Act, passed in 2010, greatly reduced the number of uninsured people in the United States. 315 3 million Black people previously uninsured obtained insurance. 316 However, the U.S. Supreme Court made expansion of Medicaid eligibility under the Affordable Care Act optional to states rather than mandatory. 317 The expansion of Medicaid eligibility would have increased access to screening and preventive care, resulted in earlier diagnosis of chronic conditions, and improved mental health. 318 However, the states that chose not to expand Medicaid were primarily the Black Belt states: Alabama, Florida, Georgia, Mississippi, North Carolina, South Carolina, Tennessee, Texas. 319 African Americans are among the most likely to be uninsured compared to other populations, further inhibiting African Americans from accessing quality healthcare. 320 Medicare does not cover all healthcare services that an individual may need, and often supplemental coverage is needed. 321 This coverage is sold by private insurance companies, or may be provided by employer-sponsored retiree benefits. 322 However, due to the low levels of employer-sponsored health coverage for African Americans and the expense of private insurance, older African Americans are far more likely than white Americans to rely solely on the Medicare program, or may supplement it with Medicaid. 323 About a quarter of African Americans lack supplemental coverage, while only 10% of white Americans lack supplemental coverage. 324 The lack of supplemental insurance exposes African Americans to higher out-of-pocket costs and delayed medical care. 325 Discrimination in Medicare. Extends to the quality of medical services. 10% of African Americans receiving Medicare report unwanted delays in getting an appointment and problems finding a new specialist, while only 6% of white Americans report similar problems. 326 Consequently, the discriminatory health insurance system has resulted in worse health for older African Americans who rely on Medicare. In early 1970, the Black Panther Party published in its newspaper an account of the disrespectful, unprofessional, and even authoritarian encounters between physicians and their patients at San Francisco General, California. To address the lack of healthcare services and medical discrimination experienced by Black Californians, the Black Panther Party attempted to provide free healthcare clinics to administer basic healthcare services. 327 In early 1970, the Black Panther Party published in its newspaper an account of the disrespectful, unprofessional, and even authoritarian encounters between physicians and their patients at San Francisco General, 328 Shortly after, the Black Panther Party established a few free, community-based clinics, known as People's Free Medical Clinics. 329 At the clinics, medical professionals trained health workers to administer basic services. 330 However, local governments retaliated against the Black Panther Party's clinics. The Oakland Police Department, on the order of the Federal Bureau of Investigation, hounded the Black Panther Party for soliciting clinic funds without proper permits. 331 In 1969, police in Los Angeles raided the local Black Panther Party chapter's headquarters, where the party was planning to open the Bunchy Carter People's Free Medical Clinic. 332 The raid severely damaged the clinic building enough that its forthcoming opening was postponed. 333 Physicians are less than 3% of the entire medical profession, despite African Americans making up 6% of the state's population. 334 The passage of Proposition 209 in 1996 in California prohibited the consideration of race, ethnicity, or national origin in public education. Employment and contracting. 335 As a result, in California's private medical schools, the proportion of Black students matriculating fell from 6% in 1990 to 5% in 2019. 336 Black physicians in California have alleged that the Medical Board of California disciplines Black doctors more than white doctors. 337 Research shows that Black physicians in California were more likely to receive complaints and have their complaints escalated to investigations than white physicians. But these investigations were not more likely to result in disciplinary action. 338 Black physicians have been historically underrepresented in California's medical field and continue to be underrepresented and discriminated against today. Black Californians continue to face discrimination in healthcare and disparities in health outcomes. 339 In 1965, in the Watts neighborhood of Los Angeles, an area with a large Black population, only 106 doctors were serving over 250,000 residents, a doctor-to-patient ratio of 1 to 2. 377,340 The United States today has a doctor-to-patient ratio of about 1 doctor per 384 patients. 341 Today, Black Californians experience racism in their interactions with the healthcare system, and many have wanted more access to black physicians. 342 in a study conducted in 2021 where 100 black Californians were interviewed. Some recounted experiences of delayed or missed diagnoses due to inattentive healthcare providers. 343 One black man from the Central Valley said, "I couldn't hold down any food, I couldn't walk, I couldn't eat, do anything, so I went to a clinic and I told them what was wrong and they prescribed naproxen, which is generic for Midol and Advil. I went to the hospital and had dual kidney infections. I just don't think they take me seriously. I don't think they take me as seriously as they would a white man or a white woman." 344. Black physicians in California have alleged that the Medical Board of California disciplines black doctors more than white doctors. Research shows that black physicians in California were more likely to receive complaints and have their complaints escalated to investigations than white physicians, but these investigations were not more likely to result in disciplinary action.